Di Gleneagles Hospital Medini, Johor, kami faham bahawa anda bukan sekadar seorang pesakit. Anda seorang ibu, seorang bapa, seorang guru, wira-wira kami, masa depan kami. Oleh sebab itu, kami memberikan perhatian kepada apa jua yang kami lakukan. Daripada keunggulan perkhidmatan kami, peralatan dan kemudahan yang serba canggih. Kepada para doktor dan jururawat kami, kami berkhidmat untuk keselesaan dan keperluan anda. Kerana di Gleneagles Hospital Medini, Johor, anda adalah istimewa dan penting kepada kami. Selamat datang ke Gleneagles Hospital Medini, Johor. Hospital yang sentiasa bersama anda.
Alright, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Dan salam sejahtera. Dengar tak semua? Boleh dengar tak? Macam tak ada noise. Boleh dengar tak? Kalau boleh dengar, thumbs up. Tak boleh dengar. Okay, boleh dengar clear Okay, kita akan accept dalam tempoh 10 minit semua yang dah register. Lepas 10 minit kita akan accept siapa-siapa saja yang tak register lah. Okay, sebab hari ini specialnya siapa yang bersiaran langsung di Zoom, pihak hospital bagi percuma complimentary gift 10 unit yang worth RM180 ya. Jadi stay tune sampai hujung rancangan. Alright. So, saya kenalkan, nama saya Hedalina Haji Nurhani. Saya adalah CEO RHN Consultant dan agency director di IKTiSAS. Okey, sedikit sebanyak saya terangkan berkenaan dengan IKTiSAS, yang mana IKTiSAS adalah sebuah syarikat ALC Bumi Putra pertama di bawah naungan Takaful Ikhlas Family Berhad yang terdiri dari gabungan GAM-GAM dan IKTiSAS terdapat di seluruh Malaysia. Kami sangat berpengalaman dalam perniagaan takaful di Malaysia, yang mana jika digabungkan pengalaman agensi melibatkan melebihi 200 tahun ya. Jadi konsep perniagaan di IKTiSAS juga sangat mudah, yang mana kami hanya menekankan konsep M4R1, iaitu rakan niaga hanya perlu dapatkan 4 kes sebulan dengan 1 rekrutmen. Sangat mudah. Okey, kita berbalik kepada topik kita hari ini, iaitu tahu atau tak tahu, bulan November adalah bulan Kesedaran Kesihatan Lelaki. Jadi sempena bulan Kesedaran Kesihatan Lelaki, hari ini kita menjemput pakar urologi dari Gleneagles Hospital untuk berkongsi berkenaan dengan common urological condition among men. Okay, with us today, we have Dr. Alan Sim, resident consultant. So how are you, doctor? You can unmute your mic.
Yes, thank you. I'm good. Thanks. How are you?
Okay, great. Okay, doctor, probably you can introduce a little bit about yourself before we proceed with our main agenda today.
Okay, sure. Maybe I show my next.
Yeah, okay.
Okay. Okay, so thanks everyone for the invitation. Thank you for having me today. So my name is Alan. So I just joined Gleneagles Medini. So previously I was trained in Singapore. I was working in Singapore General Hospital for the past 15 years. I did my fellowship training in robotic laparoscopy and endourology in Germany. And before coming back, I was also director of endourology as well as robotic surgery in Singapore General Hospital. So I just came back in late August. The reason why I came back is my actually my wife is a gynecologist here in Gleneagles Medini, Dr. Alexandria C. So before a year ago, I was commuting between Johor and Singapore, and then because of COVID, I was stuck there, and then she was here. Then we decided we have to make a decision. Either she comes and join me, or I come back and join her. So the final decision is I come back to join her. So that's why I'm back here late August, did my 2 weeks of quarantine, then started in early October. So it's been only just over a month that I've been in Gleneagles Medini, and so far so good. Enjoying myself back here. Thank you.
Okay, very great. And also very strong background from you, Doctor. Thank you. Okay, nampaknya kita punya audience hari ni pun dah 27 orang. Dan kita pun ada, hari ni bukan saja kita live dekat Zoom, kita juga live di Facebook. Facebook pun kita ada viewer. Okay, nampaknya sekarang dah pukul 28 minit. Okay, so semua pun dah tak sabar-sabar kan nak tunggu sharing dari Dr. Alan kita untuk topik hari ini. So I think I hand over the floor to you, Doctor, to proceed with the sharing.
Okay, thank you. Yeah, you can hear me quite clearly, right? Not a problem?
Yeah, very clear.
Okay. Okay, good. So I will do my presentation in a bit of hybrid between English and Bahasa, because I think I haven't used Malay to do presentation for a long time. So sorry if my Malay is not doesn't sound so professional. So okay, so the topic today is common urological condition, penyakit urologi yang biasa. So actually, urological condition is more common than we think. Just that a lot of times we don't know what to look out for. We don't know which doctor to see actually. So I think previously we have seen a lot of urology patient who's actually seeing other specialists because they really don't know what kind of symptoms to look out for, and then when to see a doctor. So this is the purpose of this little sharing to give an insight to the common urological condition. So any outlines? So we will talk about BPH. Actually, I don't know if we cannot find a translation for BPH in Malay. So does anyone know what is BPH in Malay? I don't think there is. I try to use Google Translate. There isn't a official translation. So, but I think everyone knows what is BPH. It stands for benign prostatic hyperplasia. Of course, cancer prostate itu memang biasa. And then we talk about men's health, kesihatan lelaki. And then next one, I think, which is very, very common in Malaysia, more common in Malaysia than in Singapore for some reason, is batu karang. So I will talk about all these conditions. So I think we can make this, we can either ask questions at the end, or if you feel that you have any questions as I'm going through the slides, if you find that there's some parts that you don't quite understand, you need more explanation, you can immediately ask the question, put out your hand, and then we can go through them in details. Okay, so here we go. So BPH, benign prostatic hyperplasia. So biasanya is associated with the symptoms that we see is two types. One is penyumbatan, which is voiding symptoms, means feels that your urine is macam sumbat. And then the other one is storage symptoms, means gejala simpanan kencing. You feel that you have to pass urine more frequently. I will go through this gejala-gejala in more details later. So BPH memang sangat biasa. I think 70% of kaum lelaki berusia 70-an akan mengalami gejala bahagian bawah saluran kencing. The gejala bahagian bawah saluran kencing is what we call lower urinary tract symptoms. It's the symptoms that men commonly complain of. So as I've mentioned, the gejala bahagian bawah saluran kencing can be divided into gejala simpanan or gejala penyumbatan. What is the apakah contoh-contohnya gejala simpanan? Is frequency, kekerapan. You feel that you have to kencing all the time. Sometimes it can be very urgent, macam mendesak. So sometimes so urgent that you can even lose your control, become incontinence. And then there is the term called nocturia. Nocturia maksudnya when you go to sleep, then you have to get up to pass to kencing. So it is very different from some patients come and tell me that they kencing 2, 3, 4 kali at night, but it is not because they feel the urge, they feel like passing urine, then they wake up. A lot of times because as you age, you might not sleep so well, then you are awake, cannot sleep in the bed, then nothing to do, then you go and kencing. So that one is not nocturia. So nocturia, it has to be, it's so urgent that you wake up from your sleep and then you go and kencing, then you go back to sleep. So the morning urine that you do is also doesn't count towards nocturia. So anyone that has nocturia more than one time is considered abnormal. So biasanya sepatutnya you should sleep through the night lah. So as long as you have to get up one time even to pass urine is considered abnormal. So yang lainnya gejala penyumbatan. So one of the common symptoms that we see is hesitancy. I think the translation here is not accurate. It shouldn't be keraguan. It should be, that means you take a long time to kencing. You feel like you want to macam mau kencing, tapi take a long time, stand dekat toilet for a long time, baru kencing baru keluar. So that's a hesitancy lah. Then of course you akan rasa alirannya memang tak kuat, kekuatannya memang menurun lah compared to when you are younger. Then of course when you feel that is the strength is not there, you have to menerang semasa kencing. So you have to put a lot of effort, a lot of straining to pass urine. Sometimes lepas kencing you feel that macam punit kencing tak empty lagi, tak kosong lagi. So you feel that is incomplete, empty, macam mau kencing lagi. So itu sebab itu prostate memang telah sumbat. So when you pass urine, tak semua, not every bit of a urine come out lah. So some still left in the bladder. So you feel that you want to kencing again. Of course, when it's very serious, mungkinannya akan menjadi masalah tak boleh kencing. So urinary retention lah. So you have a full bladder, you will feel pain at the lower part of the abdomen. And sometimes when it's so serious and over a long period of time, if you don't see doctor, it is not diagnosed, you can get what we call overflow incontinence. So the translation is inkontinasi limpahan. So it means the bladder, so sometimes the bladder has been full for too long a period of time. So it's like a dam. So the water the urine will just leak out when it's too full. So a lot of times the patients say, oh, I can still pass urine, a bit of urine come out, but they will realize that they have no control. It is simply because the bladder, the punit kencing is already too full, then the urine just leak out a little bit on its own. So this is not normal. This is not healthy. So this is all these are abnormal. So when you have all these symptoms, memang have to see a pakar urology for this problem lah. So the lower urinary tract symptoms does not always mean that you have BPH, but BPH is the most common cause of lower urinary tract symptoms. So that is one of the message. Of course, you can get these symptoms in male and female, but in male, most of the time it is due to BPH. So apakah sebabnya you get BPH? Most of the reason is because as you get older, the prostate akan menjadi lebih besar. The reason is because prostate akan exposed to itu sex hormone, androgen lah. So as long as you are older, the longer the exposure of the prostate to this androgen, which is the sex hormone, the prostate will get bigger. So a lot of times, a patient will ask me if is it possible to prevent the prostate from getting bigger. My answer to them is possible if you can prevent aging. And if you can prevent aging, then the prostate will not get bigger. So essentially, it will get bigger. So once you can see on the diagram here, on this diagram, this is abnormal prostate, prostate yang sudah jadi besar lah. So you can see that how the prostate cause problem. So this is your bladder, this is pundi kencing. So urine sepatutnya keluar dari sini to outside. So as the prostate gets bigger, this prostate will compress on the urine passage. So it will block the urine passage. So there's two ways you can block the passage. There's a static compression due to just the sheer size of the prostate, and then there is the mampatan dynamic urethra. So it's due to the smooth muscle component otot licin stroma prostate, which is usually located at the bladder neck right here. So the symptoms, how bad is the symptoms? Usually is related to the size of the prostate, but it's not always accurate. Sometimes you have patients with very young prostate yang kecil, tapi they have a lot of very severe symptoms, or you have patients with very huge prostate, but they might not have much symptoms at all. So we always need to not just use the symptoms alone. We have to look at the prostate size, and there are other measurement we have to use to determine the severity of BPH. So what happens when the patients that you refer to come and see us? What is the thing that we do for them? So usually we have to go through pemeriksaan physical. Pemeriksaan yang lengkap should include, I have to check the perut, especially the lower part of the abdomen, to see whether I can feel the pundi kencing or not. Sometimes the patient comes with a full bladder, so you can feel that the lower part of the perut can have like a ball just at the lower part of the tummy. That's because the pundi kencing sudah penuh, so you can feel the presence of the bladder. So of course you have to check the external genitalia. Some patient, they can have very tight foreskin, which the term we use is phimosis. So sometimes the phimosis can be so bad, the foreskin can be so tight that the urine actually cannot come out, jadi sumbat. Then also can have a urinary retention. If you have elderly patient, especially patient yang pernah ada stroke, kena buatkan pemeriksaan neurology yang fokus. Have to check, make sure the legs are okay, make sure they have control over their motion, make sure everything is okay. And then we will also buatkan what we call pemeriksaan rectal digital rectal examination, which involves me using a glove finger and putting lots of gel, as similar to what we see here, and then the finger goes into the anus where you pass motion, and it will feel the surface of the prostate. So this is very important. Why is that so? Because number one, we can know the size. We can feel from the examination how big is the prostate. That's one. Number two, prostate yang sehat, yang biasa should feel smooth, licin. You should not feel anything. You should not feel any hardness. You should not feel any lumps or bumps like that. So it should be smooth and should be firm but not hard in consistency. So digital rectal examination is one of the most important thing a urologist can do for the patient to decide whether is it likely to be cancer or not cancer. So it is something that we must do for all the patients. Of course, we have to do assessment to make sure the patient don't have any other concurrent medical problem. And for my clinic, we also do bedside ultrasound. So we do ultrasound, tengok, do a scan, check buah pinggan, check pundi kencing to see if there's any swelling of the kidney. And also sometimes the bladder might not be palpable. Sometimes the patient, the lower part of the group might be very, very thick, or patient might be a bit more obese. You might not be able to feel the pundi kencing. So the ultrasound can be used to see whether the bladder is full or not. And of course, you can also measure the prostate size using the ultrasound. So lepas pemeriksaan bedside examination, we will do lab examination. So we will send the urine for urine analysis and send for urine culture, and then we will also do this PSA, antigen specific prostate, or in English is prostate specific antigen. We will talk a little bit about PSA. Basically, I don't recommend everyone to go through PSA examination if you are just seeing family physician. The reason why is because PSA can be misinterpreted. Sometimes the PSA might be normal, but you can still have prostate cancer, or sometimes the PSA can be high, but it might not be due to prostate cancer. So they might be worried for no reason. They might go through unnecessary investigation. But for us, if you are seeing a urologist, if you are 50 years and above, yes, PSA test is a good test for you to detect for early detection of prostate cancer, because most of the time prostate cancer don't have any symptoms. Tak ada apa-apa gejala. By the time you have any symptoms, it's usually late stage. So PSA is a good test for us to pick up prostate cancer at the early stage. So there's something that we do, which I'll show you in a picture later. It's called Skor Gejala Prostate Antarabangsa, IPSS, International Prostate Symptom Score. And then we will also do a blood test to check the fungsi buah pinggang. So by doing a blood test called a creatinine. So this is the International Prostate Symptom Score. We will get to the patient to fill out. We have this questionnaire in English, Malay, as well as in Chinese. So basically, the patient will tell us how frequent in the past 1 month, how frequent they feel that macam kencing ada sumbat, or macam kencing itu power tak kuat, or mesti menerang, or all these things. We will get them to fill it out for us. And then most importantly, we will also talk about, you might not be able to see, but at this bottom here, also we want to know how is this affecting their quality of life. Because a lot of times the symptom score might not be too bad, but however, it is actually to the patient, it is affecting their life. So they might not be very happy, though on this questionnaire they cannot voice out how unhappy they are. So we use the quality of life as a surrogate to how badly affected they are by their prostate condition. So it's divided into mild, moderate, and severe, depends on the score. So biasanya we also do a Euroflow. So we get a patient to kencing dalam satu mesin, yang mesin itu boleh mengukurkan speed speed of the urine lah. So if you can see here, yang this graph ini, this is graph yang biasa. So most young men, will get a flow like that. So it should go up fast and then come down fast. This is biasa. This is healthy. This is sehat. So this graph here that you see is not normal. So this one, the flow goes up very, very slowly, and then it takes a long time for you to empty. So usually we use the cutoff. Oh, can't see my slide. Oh, is it? Is it just this one? Oh, okay. Okay. Sorry, there's some issues with the slides. We'll try to fix it first. So far, any questions so far?
Hello, Doctor. Hello, test. Ya, Doktor, dengar tak saya?
Can you?
Dengar tak?
Dengar tak? Yes.
Hello, dengar tak, Doktor?
Sekejap ya, nanti ya. Doktor
Okey.
tak dengar sekejap.
Doktor tak dengar.
Okey dah, tadi disconnected.
Oh, disconnected.
Ha.
Hi.
Hello doktor.
Okay. Sorry. Something wrong with the connection just now.
Yeah,
Okay,
you listen to me?
Yes, I can hear you now.
Okay, doktor. I want to ask one question.
Yes.
Apakah makanan yang baik untuk menjaga buah pinggang dengan pundi kencing? Maknanya yang baik untuk buah pinggang dan pundi kencing. Ataupun
Specific-
makanan-makanan yang boleh kita elakkan lah.
Okay, so if you are talking about makanan yang specific to buah pinggan dan pundi kencing, or makanan yang specific to prostate, yang itu tak sama lah. So if you are talking about kesihatan buah pinggang, I would suggest as you grow older, you should kurangkan makanan yang fried food, yang too oily, not too much of salt. That is specific to kesihatan buah pinggang. But there are some people who talk about makanan yang untuk kesihatan prostate. Itu memang studies have shown there is no such food that is good for prostate. There are some articles that say tomato, certain things is good, but the studies have shown there's no difference. So specific to prostate tak ada. Specific to buah pinggang, kesihatan buah pinggang ialah kurangkan fried food, kurangkan salt, itu saja.
Oh, maknanya kurangkan garam lah doktor.
Garam, kurangkan garam.
Oh, ada suggestion dari segi minuman ke makanan yang baik untuk buah pinggang doktor?
Okay, minuman
Doktor putus. Tak dengar doktor?
Line doktor tu.
Tak dengar doktor?
Sekejap.
Line doktor Emily.
Hi, sorry.
Ya doktor, okay.
Can you hear me now?
Okay. Yeah, yes.
Sorry, connection here tak berapa stable. So, the best is so yang best is memang air kosong lah, plain water.
Okay.
Kurangkan sugary drink like Pepsi, Coke, or need
Okay.
because all these
Okay.
things can cause other problems, diabetes kah, kencing manis kah,
Yeah.
high cholesterol, hypertension, all these things can cause lah. Of course, then they can affect kesihatan buah pinggang juga. So try to avoid these drinks lah. Yeah.
Okay, doktor.
Okay, so we will continue with the slides. You can see the slides, right? Okay. Okay. Can you guys see my slides? Okay, good. So I will continue. So what is the management? What is the treatment option for patients that present with all these symptoms? So usually, as I previously just now answered the question, we have to advise the patient to change their lifestyle, langkah-langkah gaya hidup. So I always advise bersenam, kurangkan caffeine, or of course alcohol to avoid, kurangkan minum air at night, especially. Usually, I advise the patient to stop drinking around 6 to 7 p.m. And if you are really thirsty, just take sips of water. Just wet your lips. Nothing as per normal anymore. And then before you go to bed, just try to go to the toilet to pass one time urine, and that should reduce the frequency that you have to get up at night. Of course, if just by doing lifestyle langkah-langkah gaya hidup, there's no difference, then you still have to makan ubat lah. So yang ubat yang biasanya, there's a few types. We can give alpha blockers, which is the common medication. Sometimes you might see your patient have is Hytrin, Zatral, Hanal. These are the common names of the medication. Then there are other medications such as Proscar, Avoda. I will describe in details what this medication does later. Sometimes kami akan combine medication ini because sometimes the prostate is too big. So one medication might not be good enough. And then I will talk on this medication called Cialis Tadalafil, taken daily for the management of BPH. Of course, at the end, if medication lifestyle doesn't work, they have to go on to have surgery done. So just to share a little bit, just in case you see patients that is taking Cialis 5 milligram daily for the treatment of BPH. So you might be curious, for those of you who knows what is Cialis. Cialis is actually used for condition of erectile dysfunction. So it is previously used in just in erectile dysfunction, but we found that at a lower dose, at a 5 milligram for erectile dysfunction, we take 20 milligrams. So for BPH, we take at a much lower dose, 5 milligram, but you take every day. So this is the only medication for that is used for erectile dysfunction that can also be concurrently used in a patient with BPH. So you'll be surprised there is actually a lot of young men that has concurrent erectile dysfunction and BPH. By young, I mean anyone that is 40 and above. They can actually already have a bit of erectile dysfunction and mild prostate enlargement. So this medication is a very good option for them because it can kill two birds with one stone. So you can treat both of these conditions with just one tablet. So there's so some of the medication that I mentioned just now, the alpha blockers, which is the Hytrin, Zatral, Hanal. When the patient take the medication, we advise the patient to be a bit careful. They take it right before they go to bed because sometimes they can get a bit of giddiness, postural giddiness. That means when they get up, bangun dari tidur or bangun dari duduk, they can get a bit of, if they get up too fast, they can get a bit of lightheadedness, they can rasa macam pening. So that's one of the things that we advise the patient take right before bedtime. And when you are getting up, just get up slowly. And then they get this phenomenon called retrograde ejaculation. Means when it is not so big a problem for elderly gentlemen, but for slightly younger patients, when they are sexually active, when they ejaculate, the semen doesn't shoot forward. The reason why you get this condition is because the alpha blocker relaxes the bladder neck. So when the bladder neck is open, when you ejaculate, in a normal situation, the bladder neck should tutup when you ejaculate so that it shoot forward. But when you take this medication, the bladder neck is always open. So then the semen has the choice of either going forward and going backwards. So sometimes you go backwards. So in about 60-70% of the time, they get this condition. So for young patients, this can be a big problem. So we have to let them know. And sometimes they get hidung tersumbat, so nasal congestion. That's also one of the conditions that they can get. So for the other medication, the Proscar and Avoda, which you commonly see patients take for a long period of time, this medication actually shrink the prostate. So have to take for a long period of time, few years, many years, or even lifelong, because it will continue to shrink the prostate. So again, this is not so suitable for younger patient who's sexually active because you can cause the patient to lose the nafsu sex, decrease the libido, and then they can get mati pucuk, which is erectile dysfunction. Very rarely they get breast tenderness, means sakit dekat chest dia, payudara. Of course, in men there's no breast, but in the chest area. Then the other medication, which is the Cialis, that you can give patient to take daily. Sometimes they get pening, they get sakit kepala, and then they get this flushing, the muka macam merah. So these are the common side effects, the kesan sampingan of this BPH medication. So you might want to, some patients might ask you this question, so you can advise them. These are some of the common side effects that you see with this medication. So when is it that they need surgery? So some of your patient has been seeing us for a long time, then eventually we put them out for surgery. So it will be good for you to understand what is the penunjuk untuk pembedahan. So number one, most important is they don't feel better. even after medical treatment. So they still feel that the symptoms is disturbing them, even despite taking the medication for a long time. Or they have komplikasi that is berkaitan dengan BPH. What are the komplikasi? So number one, urinary retention means cannot pass urine. Number two, the the urine has been in the bladder for too long. It backflow into the kidney, and this can cause the kidney to be bengkak. The buah pinggang macam jadi bengkak, and this can affect the kidney function. If it's severe enough, they might even go into kidney failure. They might need dialysis. Sometimes the the urine problem, it has been for a long time. They can't empty the bladder. There's always a lot of stagnant urine in the bladder. They get this bladder stone, batu karang dalam pundi kencing. And then same principle, if the urine doesn't move in the bladder, you can get UTI, infeksi saluran kencing, that happens repeatedly. And then sometimes you can get kencing darah, and of course, as I previously mentioned, you can get kidney failure as well. So what the surgical approaches depends. Number one, size prostate, and then the surgeon's experience and judgment, and of course depends on the condition of the patient. So just want to share some of the teknik pembedahan yang we offer here at Gleneagles Medini. I think the most common term that you hear is TURP, or some people call it TURP. The translation is resective transurethral, or sometimes you do what we call enuclease prostate. So this is still the oldest form of surgery. It is still the most commonly offered surgery for patients with moderate size of prostate. But here at Gleneagles Medini, we also have an option called the minimally invasive surgery, pembedahan invasive minimum. So there are many ways to treat prostate. So you can use the electricity, as you can see here. This is actually a technology from Germany. So we did the first study in the world when the technology was brought in from Germany. We actually did a study in Singapore General Hospital, and basically it's a local anesthesia procedure. We put a catheter in, the needle pokes into the prostate, and then we give electricity. Basically, we electrocute the prostate, and then after that, we take out the catheter, then patient's prostate will shrink after a period of time. And then you have this term that is called Urolift. At this moment, Urolift not available dekat Malaysia. Is commonly used in Singapore. You can see here, dia macam stapler saja. So this is a normal prostate yang sumbat. Then you go in there with this special device. Then you stapler the prostate. So you open up this space. So you see this channel jadi lebih besar. So your saluran kencing akan jadi lebih smooth lah. So that's one of the options. There are other things such as called Resume. Again, not available in Malaysia yet. But what is going to be available here is what we call ProLift, which is the last diagram you see here. Basically, similar concept, local anesthesia procedure can do in a clinic. We put in a catheter into the bladder. So this is the catheter inside. We blow up the balloon, and then there's another separate balloon here, which will stretch the prostate. And then it will stretch the prostate. That's one. Number two, it will also deliver microwave energy to burn the prostate at the same time. Again, this is a LA procedure. Don't need to stay in hospital. Everything done in the clinic. The takes about 30 to 40 minutes. These options are all very good for those patients that is elderly, on wheelchair, a lot of heart problem, high blood pressure, diabetes, so not suitable for surgery. So these are very good options for the patients, or for those healthy patients who don't want to take medication. So you can offer this as an option. Of course, we also use various laser, green light, holmium laser to treat the prostate also. For sometimes not common, you see patients that have prostate bigger than 100 grams. Then you might have to do this surgery called simple prostatectomy. The name is called simple, but actually it's far from simple. We have to do usually traditionally is open surgery, but now I usually do a minimally invasive surgery, keyhole surgery. We go in through the bladder and we open up the prostate and we scoop up. It's like we scoop out the prostate that is enlarged. So this is what we do when the prostate is too big. So next, I will move on to prostate cancer. So actually, how common is prostate cancer? And this November is the prostate cancer awareness month. So we will probably hear this all the time. You can see a lot of TV interview, a lot of articles talking about prostate cancer. So how common? It is actually third cancer paling kerap ketiga di kalangan lelaki. So third most common cancer amongst men, right after colorectal as well as lung cancer. So that is amongst men, but if you look at overall between men and women, it is the seventh most common cancer. So it is not uncommon. So if you look at worldwide, it is actually the second most common cancer amongst men. The reason why is because you see prostate cancer more commonly in the West, in the white. So they see prostate cancer more commonly. So that's why it's number 2 cancer. And then overall, it's number 4 cancer. So you see about 1.3 million new cases in just year 2018 alone. So it's very, very common. So biasanya, what is the way we can diagnose prostate cancer? I already mentioned ujian darah, which is PSA, pemeriksaan rectum digital rectal examination, putting a finger into the rectum to feel the prostate, very, very important. And I'm sure you have heard of what we call a TRUS biopsy, which is transrectal ultrasound guided biopsy of the prostate. So these are the conventional or the traditional way of us doing prostate cancer diagnosis. So moving forward, I think with better technology, we have to move on with time. So you might see more and more patients being offered what we call multiparametric MRI. So I look at it as a high definition TV. So if you look at this diagram here, if you look at it, the normal ultrasound might miss a lot of prostate cancer, but as they go through the MRI, you can see that the area of suspicion gets very, very obvious. So with all these multiparametric MRI, you can actually pick up a smaller and smaller prostate cancer and make the diagnosis more accurate. So I always think of it as having the MRI is like being a sniper. So instead of just being a foot soldier, infantry shooting in the dark, we are more accurate now with MRI. We know exactly where to tembak. We know where to look for the cancer, and therefore the diagnosis will be more accurate, and we can offer the right kind of treatment. So over here, we also do what we call MRI targeted biopsy. There are various platforms that we use, Mona Lisa from Singapore, BK Fusion and Coelis from America. So over the next few months, we'll be using both the BK Fusion as well as the Coelis system to help us diagnose prostate cancer more accurately. So if you can see here, this is how the prostate looks like. So this area that is pink is the area that is suspicious on the MRI. So with this, with the software, we can incorporate into real-time biopsy, and we can just focus on this area here, and then to make sure that we evaluate the prostate properly, and we don't have to take the prostate blindly. We don't have to take 100 pieces of tissue blindly just to get a diagnosis. So we can just take very targeted 3-4 pieces to reach the diagnosis. So that is very, very important to reduce the risk of surgery. And another thing that we do here in Medini, we try to convert from the TRUS biopsy, the conventional TRUS biopsy, going through the anus, going through the rectum. We want to do more and more commonly what we call a transperineal biopsy. Perineum is the area below the testis, above the anus. So it's the skin area. So why do we do that? Because the trans biopsy biasanya, there is a risk of jangkitan. Why? Because you go through the anus, which is dirty, obviously. No matter how you clean the anus, it's full of bacteria because feces is there. So there is always a risk of sepsis infection. So the risk of this trans sepsis is about 3 to 5%, and sometimes patient can die from this sepsis. So it is something that we want to avoid altogether because it is not worth dying from a diagnostic procedure, which is usually just the first step of your treatment. So we try to move away from going through the anus and try to move to just doing transperineal biopsy. So biopsy transperineal have almost zero sepsis rate. Yeah, but usually has to be done under general anesthesia. So why is that so? Usually, normally the transperineal biopsy, as you can see in this diagram here, they need this little stepper, and then they have to poke the prostate many times through the skin. Therefore, patient might be in a lot of pain. They need anesthesia. But with this new device that we see here called a precision point biopsy, it is this little device here that is mounted on the ultrasound, and with this we can just do targeted biopsy with 2 skin puncture on the perineum. So you don't need to puncture the skin 20, 30 times, even though you need to poke the prostate 20, 30 times, but a skin puncture only just 2 points. So you just need to give ubat bius for the 2 points, and then you can proceed with the biopsy. So this can be done under local anesthesia without any sort of sedation. So next, after from prostate cancer, I will talk about men's health, which is actually a common problem, but we might not, patients might not be aware enough to come forward to see urologists for that. So there are common conditions: andropause, multipucuk, and premature ejaculation. So andropause, it is becoming more and more common. It is basically male menopause. So as female goes through menopause, men also go through andropause. Why is that so? Because our tahap testosterone akan turun sebab due to aging. So what are the symptoms? You can feel very tired, kelusuan, you feel murung, moody, and then you will feel some of the patient, the bone density will decrease and the muscle mass. So you see that they are losing their muscle. The bone also become more and more fragile. And then they will have a decrease in the libido and multipucuk. So what are the investigations that we usually do for the patient? We will check the sex hormone, which is the serum testosterone. And then we will consider giving them testosterone replacement therapy if the patient is symptomatic. Doesn't mean that the testosterone is low, means you have to treat them. If they don't have any symptoms, as mentioned before, they're not moody, they're not tired, they don't have decreased bone mineral density, they don't have decreased libido, they don't actually need treatment, because everyone will go through this. It doesn't mean that you must replace testosterone for everyone. So how do you replace testosterone for those patients who are symptomatic? You can give a cream topical, which is called androgel. You can have oral medication, and then you can have an injection called Nebido. The injection can be given once monthly or once 3 monthly. So it depends on the patient's testosterone level. The next common condition is erectile dysfunction. So I found this quote online. So men can survive earthquakes, can experience horrors of illness, and all the tortures of the soul. But the most tormenting tragedy of all time and will be the tragedy of the bedroom. So because men generally has a huge ego, so they might not admit. So they always look very tough outside, but when it comes to the matters of the bedroom, it could be something that bothers them a lot. So what is the definition of multipucuk? Is inability and consistent untuk mencapai dan mengekalkan ereksi yang cukup untuk hubungan seksual yang memuaskan. So these are very, very important definition. Because all these conditions need to be met for you to label someone to have mati pucuk. Why do I say that? Because if it's once in a while, it might just be stress, you're just tired, so it doesn't mean that it's erectile dysfunction. If it's not hard enough, but they can have satisfactory sexual intercourse, is also not a problem because it is not disturbing them. Yeah, so it has to be consistent and it's affecting their sexual intercourse. That is the definition of erectile dysfunction. It is very, very common. Actually, this statistics is for Malaysian population. So bilangan case mati pucuk di kalangan lelaki Malaysia yang berumur lebih dari 40 tahun is as high as 70%. So it's very, very, very common. It's just that the patients are not aware, they are shy, they don't come forward, they don't come and see doctor. So apakah punca erectile dysfunction? Most common is actually psychogenic. These days we are stressed over COVID, stressed over work, stressed because of quarantine. So all these things can cause you to have erectile dysfunction. Of course, if you are elderly, you have a lot of medical problems like diabetes, or you have a heavy smoker, you can have what we call vasculogenic problem. So the blood vessels are all calcified. If you have high blood pressure, all this can affect your blood supply to the penis. And of course, if you have trauma, injury to the penis also. And of course, it can be due to other conditions such as what I mentioned, old age, diabetes, penyakit jantung, or penyakit buah pinggang chronic. So all these conditions can cause this. And of course, neurogenic. If you have previous stroke or you have Parkinson's, all of these things can cause erectile dysfunction. Of course, for patients who have previous pembedahan pelvis or previous therapy radiasi, this can also cause erectile dysfunction as well. And then the other one that I've mentioned, which is andropause, is one of the major cause as well. Smoking can cause it, taking alcohol, and some blood pressure medication and antidepressant can also cause erectile dysfunction. So how do we treat the patient? As I've mentioned, the common cause is actually psychogenic. So counseling is very, very important. You want to make sure that you want to find out if the work is stressful, find out if there's any relationship issue from them, and then counsel them accordingly. A lot of times, once they relax, all these issues are settled, the erectile dysfunction also disappears. Of course, if counseling fails, you have to rely on medication, as I had mentioned before. Cialis, or commonly used, is Viagra. There is peralatan vacuum, or you can do surgery. The medication, the common one is Viagra, Cialis. There's a new medication called Spidra. As the name indicates, it works very, very fast, so that's why it's called Spidra. One of the things I tell patient is there is no biological dependence. So it doesn't mean that once you start makan ubat, whole life you have to take medication. So it's not a hormone medication. So sometimes some young patients they go through a period of erectile dysfunction, they are very worried to take medication. So what I advise them is you have to break the psychological barrier. So you take the medication, break the barrier, break the vicious cycle, you have normal erection, then next time you won't be dependent on this medication. So some of the common side effects that you get is sakit kepala, you can get flushing, kemerahan, you can have pening, and sakit otot. So these are the common side effects. And then the surgery that I talk about, you can do this vacuum device for the patient. It's quite uncomfortable, so not many patients will agree to doing this. And then sometimes in severe cases, you will have to go through what we call penile implant. So this again is a major surgery. Only those slightly younger male who's very, very affected by their erectile dysfunction would consider this option. So the next topic that I'll move on to is penyakit batu karang, which is very common, keadaan yang sangat biasa. Actually, more than 60 to 80% case urologi berkaitan dengan penyakit batu karang. So it is affecting about 12% of the world's population. It's quite a lot of people with batu karang. So commonly seen in 20 to 40 years old. And it is very common to have relapse. So if you have patient with stone, we always put on the form there, is a recurrence common? The answer is yes, because 50% of them will get stone in the next 5 years. So it's very common. So what is the batu karang? What is a urinary stone? So it is not gallstone. So it is not a gallbladder stone. I sometimes see patients that come to see me because of gallbladder stones. As long as they hear the word batu, they come and see a urologist. So urologists only see batu yang dalam buah pinggang, dalam ureter, saluran kencing, or dalam pundi kencing. So you can have batu dalam this one in the kidney, occupying the entire kidney, or you can have stone in the ureter, which is the most commonly seen condition, and or you can see batu dalam pundi kencing, which is usually very round because the stone has been rolling around in the bladder for a long period of time. So what is the cause? Apakah sebabnya we get batu karang? Most of the reason is due to our lifestyle. So kekurangan air, so that's why it's very common in young patient. And punca diet. So what are the diets that cause stone? I think I have, no. Okay, I don't have the slide, but what are the diet that cause stone? Strawberry, chocolate, peanuts, coffee, tea, basically things that is rich in oxalate and things that is rich in uric acid. And then seafood, red meat, and inner organs, and of course alcohol. All these can cause stone. Jangkitan urinary tract infection can also cause stone. Sometimes, due to medication, not due to dada, due to medication. Yeah. And then of course there are some patients with genetic condition that predispose them to stone. It's very uncommon in this part of the world. It's more common in the West. So we seldom see this. There are some patients with previous abdominal surgery, the usus get very short, then they can get stone very commonly. So how do they usually present? Commonly, you see sakit. So the sakit, they will come and they will go. The pain that they typically describe is colicky in nature. It is very severe, but very painful. Anyone who has stone before amongst the audience will remember. For men, is the only chance for us to experience childbirth. So this pain is equivalent to childbirth. So anyone who has urethral stone before will remember. They can have demam, they akan jadi pening atau muntah. Sometimes when they kencing akan ada darah, or they can have a lot of urinary symptoms. They pee very frequently. They feel that they can't empty the bladder. So how do we treat the stone? So really bergantung kepada ukuran, size of the stone, lokasi, kekerasan batu, and also patient's condition. So there are various options that I've listed here. You can have, of course, no surgery, conservative. We will encourage the patient just to drink lots of water to try to pass out the stone. I will go through these treatment options one by one. So the first, the conservative treatment, which is rawatan tanpa pembedahan. It is only suitable for stone di saluran kencing yang kurang dari 5 mm. But usually it only works for patient with stone at the lower part of the ureter. Your stone is at the proximal part, means very high up in the kidney. It will take a long time for the stone to pass. So what we advise the patient, drink lots of water, but it can take up to 4 to 6 weeks to pass. So a lot of patients are not willing to wait till such a long time. We can give them some medication, tamsulosin, which is Hanal, to try to increase the likelihood of you passing the stone. But the patient will always be counseled that they can have pain and admission again within this 4 to 6 weeks, then they can get infection. So not all patients can be treated conservatively. If the patient has signs of infection or the kidney is blocked, then the creatinine is raised, the kidney function tak bagus, then you cannot do conservative treatment. One of the treatment that we will soon have is what we call extracorporeal shockwave lithotripsy. This is what we call non-invasive, so we don't need to go into your body. Everything is done externally. So we usually, you can see this is a huge machine here, and then the shock wave is delivered through the skin, through the muscle, through the kidney, into the stone, to break the stone into small pieces, and then we rely on the patient to drink lots of water to pass out the stone. Of course, this one, tak perlu bius. Usually we just give a oral painkiller or even some intravenous painkiller. So you might see a lot of patients that have this term, this surgery called URS, LL, and DJ stenting. Usually this is because it's very long, so we usually write in that way. So it stands for ureteroscopy, laser lithotripsy, and double J stenting. So apakah itu stent double J? When do we put it in, and usually how long do we put it for? So you always see here the term double J stent. So I want to show you how it looks like. So it looks like that. One end of the stent is in the kidney, and then it goes through the ureter and then masuk dalam pundi kencing. What is the purpose of this stent? It allows the urine to flow downwards smoothly. So if there's a batu yang sumbat dekat saluran kencing, it bypasses the stone so that your kidney swelling will recover. So when do we usually put in a DJ stent? If you see anyone who has a stone surgery, almost always you will see that they have double J stent. So almost always you will put in a double J stent. We will put in the stent sometimes when the ureter is tersumbat. So we want to put in the stent for whatever reason. Sometimes it could be due to cancer, could be due to previous radiation. So we will put in the stent to let the kidney swelling resolve. There's this commonly patients that comes with a ureterate stone, and then we put them out for URS laser lithotripsy, and then they go home without the laser lithotripsy done. So you wonder what happened. Why do the patient not have lithotripsy done and then just have a DJ stent put in? That is because Asian ureter, saluran kencing Asian memang kecil. So our saluran kencing is smaller than the Westerners. So a lot of patients actually the ureter is too ketat, too small. So the scope yang tak boleh masuk itu saluran kencing, so cannot reach the batu karang. So if you cannot reach the batu karang, you cannot use the laser to break the stone. So if you cannot reach the stone because the ureter is too small, then you put in a stent first, because the stent will let the kidney swelling resolve, and it will also let the ureter expand. Naturally, this is what the stent does for the ureter. And sometimes patients come in with very, very severe infection. Those patients, you cannot do laser lithotripsy because they are sick, they are high fever, blood pressure not stable. Then these patients, we will stabilize them with antibiotics, but we put in a stent or put in a tube into the kidney so that the dirty urine can flow out. So only until they are better before we consider doing surgery. So how long do we keep the stent? So it really depends on the ukuran batu, tempo pembedahan, and also the severity of the obstruction. Usually it ranges from 1 to 6 weeks. Yeah, and then when the patients have a stent, they might call you, say, oh, I have blood in the urine. This is common. After having a stent, they will have pain at the back, at the same side of the stent, and they will have lower urinary tract symptoms such as frequency and urgency. So these are all very, very common. So to illustrate what we meant by ureteroscopy and laser lithotripsy, this is exactly what we do. We use a scope that goes into the bladder and then goes into the ureter, and then we'll locate the stone under direct vision, and we use a special device. We use a laser to break the stone into small pieces, or you use a special device to catch and then to remove the stone. So this is exactly what we do for patients. And then increasingly, you might see the term called retrograde intrarenal surgery. So what is that? that is usually for patients with kidney stone. So, or patients with stone in the upper part of the saluran kencing. So sometimes the scope cannot reach the ureter all the way. The scope that is rigid because it's very hard and the ureter is like sometimes bangkok, so you cannot reach that. Then you have to use a flexible scope which is much softer. It can negotiate through the ureter, can go through all the bangkok, and then go all the way into the kidney to use the laser. Again, use the laser, break the stone, use the basket to remove the stone. So this is what we call retrograde intrarenal surgery. And then this other term called PCNL, which is, I'm sure you have heard of it, is usually for patient with stone bigger than 2 cm. So what we do is we basically go through the skin, go through the muscle, go through the fat, poke into the kidney, and then we put a tube inside the kidney, and then we use a special device to break and suck out the stone. And of course, at the end, put a DJ stand. So in over here, myself, I started doing supine PCNL in Singapore General Hospital. Actually, all over the world, people are slowly turning into converting into doing supine. So what is supine PCNL? So normally PCNL, patient lie prone, so lie face down. So it is not an ideal situation. It's very hard to monitor them. Sometimes if the patient is very obese, very fat, it's very difficult to turn the patient. There's high risk of getting all airway obstruction. They can even collapse during the surgery. So it is not ideal, but we have always been doing it this way for many years. But since about 3 years ago, I have converted to doing supine. So instead of facing downwards, the patient now face upwards, just like normal. So you can do the surgery through this method here. So this is actually one of my fellow from Myanmar. After learning this technique in Singapore, he has gone back to Myanmar. He has done thousands of cases using this method because it's very convenient and very easy to do. So how about some of your patients who presents with stone like this? At this moment, I haven't been back in Malaysia for that long, but it's probably not so common to see stone that is this big. But in places like Myanmar, you can see stone that is this big. So this white thing that you see here is actually stone. So for this kind of stone, all the previous treatment option that I mentioned to you is probably not ideal because it will take forever to clear the stone. It's probably not possible. So this patient that I've seen from Myanmar, actually I did a robotic surgery for him. We slice open the kidney into half and then we fish out the stone. This is the batu karang. You can see this is the batu karang, and then we take it up in entirety. So this is how it looks like at the end. So this is the entire stone. I took it out and rearranged to take a nice photo to look like the X-ray. So yeah. So lastly, I think I've taken enough time. Not uncommon to hear patients that come to see us to have darah dalam air kencing. So the common cause will be jangkitan kuman, infection. But these are common. Those kind you don't need to worry. So those patients have pain when they pass urine, have fever, then it's due to UTI. It is the painless one that we have to worry. So if the patient has darah dalam kencing tapi tak ada sakit, tak ada fever, then you worry that they might have batu karang. Then most commonly you have to worry about cancer, especially if it's elderly or patient has history of smoking. They can have cancer buah pinggang. They can have cancer pundi kencing, which is how it looks like here. It looks like a coral reef. And of course, prostate cancer can also present with blood in the urine. Okay, so I think I've gone on long enough. I will open up the floor for questions and feel free to give me any feedbacks. If there's any clarification needed, please feel free to ask me. Thank you. You can also go on Facebook and YouTube to look at some of the videos I made for some of the surgery that I've done. Thank you.
Okay, thank you, Doctor.
So doctor, they are asking about the cost of each treatment.
Okay.
On the chat, there is actually questions, yes.
Okay. So cost of each treatment. Well, of course, well, it's really hard to put a dollar sign on this sort of treatment. Of course, conservative treatment, you can say that it is minimal cost Patients just need to take some tablet, painkiller, they can go home. But the cause could be that the patient can come back with a readmission, and the cause is the loss of quality of life because they worry about the stone, they can have excruciating pain again. So these are those costs that you cannot quantify. The ESWL cost, I don't think we have it yet. Our ESWL machine is coming in only by early next year. We have already approved our budget. We're doing renovation now, so we should have it in about few months time. Whereas for ureteroscopy, laser lithotripsy, wow, to be honest, I might not be the best person to advise on the cost of surgery because I haven't been here that long enough and I don't look at each individual bill. So I'm not sure, Emily, who should we get to address the cost issue? Okay, so we can make, I might not be able to give you the absolute cost, but in terms of expensiveness, I would say the cheapest option will be conservative treatment, followed by ESWL, followed by ureteroscopy, laser lithotripsy, and then retrograde intrarenal surgery, and then PCNL, and of course, lastly, is all the minimally invasive or even open surgery for stone. So that's how the gradient of the cost, but also that depends on the severity of the disease, isn't it? Yeah.
Encik Amil Mustaqim nak tanya soalan?
Radiation therapy.
Therapy.
Yeah, radiation therapy.
Okay, tadi Nizam ada tanya ya, apa tu terapi radiasi?
Oh yeah, so radiation therapy is, I'm sure you have patients before that had radiation therapy. Basically, it's done by our oncologists in our cancer center here. They use a specialized machine to deliver radiation through the skin into the body to kill off the cancer cell. So we use radiation therapy for breast cancer, for cervical cancer. We use it for prostate cancer as well. So it's very, very common. It works very well. You can treat this cancer without surgery, but a lot of patients live for a long period of time. They suffer complications from the radiation therapy. So they survive the cancer, but they suffer from the complication of radiation therapy.
Okay, so I hope that answers the question ya Encik Nizam. Lepas tu MBA ada tanya how to recover andropause if happen. Is there a recovery for andropause?
Okay, so that's the same answer for how to recover from BPH. Same. If you can reverse aging, then you can recover from andropause. But as I mentioned before, everyone will go through andropause. You and me will also eventually go through andropause, but not everyone has to have treatment. Only you have the symptoms, as I mentioned. You feel moody, you feel tired, you feel your bone, your muscle is all disappearing, then you will need treatment. So you might not reverse andropause, but with the gel androgel, the injection, ubat, all these can elevate your testosterone level and make you feel better. So you can treat andropause.
So bukan saja ya perempuan wanita yang akan ada menopause, tapi lelaki juga ada andropause, okay? Alright, so then ada another question. Andropause, what's the age statistic? Tak faham. You nak age statistic? Yeah, how common?
Okay, so
ED is common by about 40 years old onwards. It's actually getting more and more common. About 70% even have ED. As early as 30-something years old, you can have erectile dysfunction. But andropause usually happens above the age of 55 onwards, commonly seen after 60 years old. So not very different from menopause, so it's around the same time. But of course, some people can have very high testosterone till they are 80, 90 years old also. So, but very rarely to see below 40 years old. So it's again due to aging.
Okay, doctor, do you do menopause treatment?
Oh, menopause treatment meaning androgen, hormone replacement therapy. Okay, so for menopause, I don't do, but luckily I have my wife, Dr. Alexandria C. So she will do the menopause management. So I treat the lucky come and see me for andropause, then the Juanita go and see my wife for menopause in the same visit.
Okay, so menopause jumpa ONG, ya. Kalau laki andropause jumpa Dr. Ellen. Faham ya? Okay. Jadi next question. Batu karang dan kencing kotor, is it related?
Okay, so the kencing kotor, yes, but so a lot of times patients come and tell me that actually the thing about old men is they like to gather together in coffee shop, then they will talk about their kencing. So they say their kencing ada bubble, macam ada bubble. So that is not dirty urine. So kencing ada bubble is not necessarily dirty. It's not necessarily due to protein. You still need to do your urine test to confirm. But if you see kencing macam ada macam kekurahan, macam ada hitam-hitam brown color, that could be due to infection. That could be due to batu karang. So those are really dirty. Yeah.
And then Puan Laili ada tanya, there are rumors ya, 1000 mg of cranberry supplement can ease the stone problem. Is it true?
Okay.
Okay. So it is memangnya rumor. So it is not true. Cranberry tablet is useful for UTI prevention, but doesn't work for everybody. Some it works for some, it doesn't work for some. That's why if you look at evidence, actually cranberry also doesn't seem to work for UTI prevention. But for stone to melt the stone, no, cranberry definitely not. I know that in Malaysia, there's this medication called Robatinex, which is also very popular to so-called melt the stone. There's only studies from Korea that says it works. I have no experience in that. In Myanmar, it's very, very, very popular. But if you just look at this type of stone, no tablets can melt it. Of course, if it's very, very small stone, a lot of times they say they take medicine, the stone melt. It's actually not because the stone melt, it's because the stone has already passed out. So that's because the stone came out, not because the medication let the stone disappear. So this batu karang memang macam batu yang you see on the road. So those batu is very, very hard. It will not disappear with medication alone.
Okay, I hope that answer your question ya tentang rumor tu. Lepas tu Encik Muzaffar tanya, what's the cost of ESWL? Doctor, you.
Yeah, we actually don't have the cost estimate yet because the ESWL machine still akan datang. So we don't have the machine yet. We will try to tidy up our cost estimate for this surgery, and then we will give it to you. Maybe Emily can liaise with our CFO to make this information available to all the agents so that you can tell your patients. We have actually tried to make our price competitive. We actually make sure that our price is not higher than the surrounding hospital. Definitely, we will be cheaper than things like hospital like Gleneagles KL, and also competitive with KBJ Johor, Putri's specialists. So the price will be competitive. We will give you all the price list soon enough.
Okay, then another question. What's the range for urology treatment? I rasa tak ada range untuk urologi sebab it depends ya, apa masalah, apa penyakit, apa condition. So tiap-tiap orang beza-beza. So can range from 4,000 up to 50,000 pun ada. So hard to say. So yang ni I rasa doktor pun tak dapat jawab. Maybe kena jumpa doktor dulu dan tengok condition tu apa. Okay.
Yeah.
Then Dr. Ellen, what actually is the stone made of?
Okay. So the stone the commonest component, about 80% of the time, is made from calcium oxalate. So calcium is the same, the calcium supplement that we take. So that gives us the white color appearance. The oxalate is the component that I mentioned from the food such as strawberry, nuts, chocolate, coffee, tea, basically all the good things in the world has a lot of oxalate. So oxalate combined with your calcium becomes calcium oxalate. So this is the most common form of the stone. Now, of course, you can have uric acid stone. Uric acid stone is due to your high uric acid level from the food, like what I mentioned, seafood, red meat, inner organs, alcohol. Those usually don't appear like that. They are much softer. They are not so white in color because there's no calcium. Then, of course, they are rare form of stones such as ammonium stone. That's due to recurrent infection. But the most common is calcium and oxalate stone.
Okay, then I think most of them is about questions about the cost. Kalau cost tu, I rasa I welcome you all to WhatsApp saya separately. So saya boleh check harga, then I can let you know estimate lah. Yeah. So at the same time, ada tak any other question?
Amir Mustaqim, soalan unmute.
Boleh unmute ya.
Amir Mustaqim. Tabir Isa. Ada lagi soalan? Tadi.
So ada tak? So kalau tak ada, then I think we pass it back to Oh, ada soalan, ada yang naikkan tangan tadi. Siapa ya yang naikkan tangan?
Saya. Saya nak tanya tu, apa pesakit yang daripada Vietnam tu yang buat operation belah dia punya buah pinggang tu sembuh sepenuhnya ke doktor?
Patient dari Vietnam.
Yang doktor buat operation batu dia
Oh,
banyak tu.
Myanmar itu, yes.
Myanmar.
Sembuh sepenuhnya. So what we did, we belahkan itu buah pinggang macam into half lah. Then we take out semua itu batu karang, semua kasih dia bersih. Then we stitch it back. We close it back again. Jadi biasa. So kidney, buah pinggang memang macam liver. Dia akan regenerate. So dia akan recover. Then it will look just like normal again. So fully recover. But of course, if you don't take care, the batu karang akan return again. So that's why you have to take care of yourself lah. Drink more water, watch the diet macam tu.
Apa amalan makanan dia yang sampai banyak sangat batu tu doktor?
Yalah, yang those I mentioned, kacang, chocolate, strawberry, yang biasanya we like to eat lah. And then a lot of people coffee and tea. All these things can cause batu. But the most common cause still due to lack of water. That is still the most common cause lah. Jadi biasanya I advise the patient drink more water, keep the urine light yellowish in color. Then that means you are drinking enough water. So that's the best advice for the patient.
Okay, doctor, we have a very interesting question now. There is a patient, what if there's a patient who also have heart condition, sakit jantung. Tapi buat masa the same time, he wants to, can he actually go for the operation to buang batu karang? If let's say he already have a heart condition.
Okay. It's very common for us to see such patient because as you grow older, heart disease, high blood pressure, cholesterol, all these are common. Diabetes, usually part and parcel of the patient. So it's very common. It depends on the size of the stone, depends on the location of the stone, and depends what type of surgery that we need to go for. Things like ESWL is very, very low risk because tak ada abuse, tak payah GA, so even sakit jantung, no problem. But things like URS or anything that need abuse, usually if we are worried, we'll get our in-house cardiologist, Dr. Ang, Dr. Kam, to evaluate to make sure the heart is okay before we go for the surgery. Another thing about patient with ischemic heart disease is usually biasanya dia akan makan aspirin kah, Plavix kah, yang ubat yang mencairkan itu blood. So blood thinning medication, you have to make sure they have to be stopped before the surgery. So usually I will also consult my cardiologist to make sure that this medication can be stopped 1 week before the surgery and 1 week after the surgery. So, but other than that, stable heart condition, no problem to go for stone treatment.
Okay, thank you, Doctor. Is there any other question? Kalau ada question boleh unmute ya. Yang lain kalau you all have anything, you all stay until the end sebab kami akan ada complimentary test untuk to give out untuk 10 orang yang laki. Tapi kalau kan katakan the respon sangat baik ya, kita boleh lebihkan 10. So stay tune ya. So ada lagi any question?
Doktor, saya nak tanya, betul ke kalau after kita minum teh atau kopi, kita kena bilas dengan air masak?
Oh, lepas minum tea dan kopi kena minum air masak. Is that the question? Oh, I never heard of that that advice, but generally for my patient, I advise them if they like to drink tea, drink coffee, they dilute, cairkan itu tea dan kopi, jangan jadikan pekat sangat. So maybe it's the same principle, you drink tea and coffee, then you drink some water to make it a bit more dilute lah. So bottom line is you should drink more water instead of drinking all these tea and coffee, because these are the things that has very high oxalate, they can jadikan batu karang. So drink more water.
I rasa ada orang tengah cakap tapi kita tak dengar sangat. Boleh kuat sikit?
Okay.
Any other questions? Okay, I think we pass it back to Puan Handalina. Maybe you want to continue from here?
Okay. Boleh okay,
Boleh.
Thank you, Doktor. Sangat hangat soalan bertubi-tubi masuk. So hopefully semua satisfied dengan jawapan. And Miss Emily pun ada bagi contact number tadi. Siapa-siapa yang mungkin ada soalan lagi boleh direct WhatsApp Miss Emily. Mungkin Miss Emily boleh direct jawab, tanya doktor. Okay, seperti yang Miss Emily keep war-warkan di hujung rancangan ni, pihak hospital berbesar hati untuk berikan 10 complimentary gift yang worth RM150 secara percuma, iaitu merupakan consultation dan review dari urologist, PSA blood test dan urine FENE. So based on first come first serve, get ready IC untuk lelaki umur 50 tahun dan ke atas. Dan tadi Miss Emily pun ada cakap kalau sambutan lagi hangat, hospital nak tambah lagi 10 ya Miss Emily? Okay, thank you for the sponsored hadiah. Okay. So sekarang ni saya nak share sedikit berkenaan dengan video korporat kita dan juga beberapa claim kita ikhlas lah. Mari kita sama-sama tonton video.
Idea penubuhan konsortium takaful ini bermula apabila kami memikirkan bagaimana untuk membina satu sistem keusahawanan takaful yang lebih mantap.
Individu yang terlibat terdiri daripada grup agensi manager yang berpengalaman luas dalam industri takaful yang dipengurusi oleh Encik Sarunizam bin Sazwan.
Pembangunan usahawan secara istiqomah bagi melahirkan individu yang berwawasan, profesional, produktif, kreatif, amanah dan tabligh.
Matlamat kami menggabungkan agensi-agensi yang berpengalaman dalam perdagangan takaful di Malaysia untuk membantu usahawan-usahawan takaful dalam gerak kerja berpasukan.
Visi kami adalah untuk menjadi peneraju pembangunan agensi nombor 1 di Malaysia dan misi kami adalah untuk melahirkan usahawan yang memiliki jati diri yang unggul.
My seat, my team. Mari, mari, mari.
Kami mempunyai satu sistem keusahawanan takaful yang dinamakan sebagai BOS yang bermaksud Business Owner Synergy System. Ia merangkumi 7 teras utama iaitu pengurusan kewangan, teknologi komunikasi, model latihan, dokumen perundangan, sistem rekrutmen, sistem jualan dan juga nilai ikhlas.
Sasaran kami terbahagi kepada 2. Pertama, individu yang ingin menyertai pelan takaful dan kedua, individu yang ingin menjadi usahawan takaful.
Peluang kenaikan pangkat yang mudah dan pendapatan yang lumayan melalui Business Owner Synergy System BOS.
Kelebihan yang akan dinikmati, pertama, memiliki sistem sokongan bersepadu. Kedua, kami berkepakaran untuk membimbing rakan niaga baru dengan pengalaman selama 178 tahun sekiranya ia digabungkan. Ketiga, anda pasti akan menikmati pendapatan berganda melalui promosi produk takaful ikhlas dan pengambilan rakan niaga baru.
Ultimate goal kita adalah tijarah, seorang individu yang dapat memimpin syarikatnya sendiri dan juga mempunyai minda keusahawanan yang akan dapat membawa syarikatnya ke satu tahap jutawan duniawi dan ukhrawi.
Antara klaim-klaim tu ada juga klien-klien yang dapatkan rawatan di Hospital Gleneagles. Okey, dekat video tu memang pelbagai maknanya respon daripada klien yang dah dapat claim, hospital-hospital di seluruh Malaysia lah. Jadi maknanya dekat video tu nak menunjukkan yang walaupun klien dekat dalam ward, ada yang dekat CICU, ada yang dekat HDU, Gleneagles Hospital, ada yang di ward, tapi semuanya happy. Sebab apa happy? Sebab mereka semua dilindungi oleh takaful. Alhamdulillah. So, saya nak recommend untuk beramai-ramai sebenarnya untuk menyertai plan takaful ikhlas. Boleh ambil dengan, kita ada perunding-perunding IKTiSAS dan juga takaful ikhlas di seluruh Malaysia. Dan kita juga ada tertera contact number, boleh hubungi kami semua. Sebab kami dari ikhlas memang betul-betul ikhlas untuk membantu. Sebab pada saya sebenarnya takaful tu murah saja, tak mahal. Tapi yang mahal ialah kesedaran. Sebab apa? Takaful, untuk takaful ikhlas sendiri bagi umur 30 tahun, hibah hanya serendah RM42 sahaja sebulan. Yang mana peserta boleh dapat pampasan sebanyak RM200,000. Jadi kalau kita nak cari kat mana yang boleh dapat pampasan sebesar itu dengan harga semurah RM42 sebulan, iaitu kalau kita convert kepada harian cuma RM1.40 sahaja untuk dapat coverage yang setinggi itu. So sebenarnya kesedaran tu sangat-sangat kritikal. Tapi biasanya orang sedar masa bila? Sedar bila dah sakit. Sedar masa bila? Masa doktor dah diagnose. Okey. Kena kanser prostat. Sampai kos yang terlalu tinggi baru cari ejen. Kadang-kadang cari quotation saja tapi tak firm. Finally bila diagnose baru nak cari ejen, masa tu ejen terpaksa tolong juga tapi tolong tengok je. Dah tak boleh bantu, dah kena kanser kan? Okay. Alright. Especially waktu pandemik COVID-19 ni, sebab takaful sangat murah, jadi bertindak segeralah sebelum, maknanya sebab untuk masuk takaful ni dia akan consider age, pekerjaan semua, and then kesihatan juga. Jadi jangan tunggu masa yang lebih lama lagi Okey, untuk saya sendiri sebenarnya saya dah paling besar lah kos yang saya dah handle RM118,000 untuk kes jantung, dan klien pun masa tu baru dalam setahun lebih saja dia menyertai plan takaful ikhlas, tapi dia dapat pampasan sebanyak RM100,000 lebih. So at actually selamat kocek klien untuk bayar kos perubatan yang tinggi. Jadi saya rasa bukan saya saja yang ada pengalaman ni, kawan-kawan saya juga ada pengalaman yang sama. Okey, untuk kita memudahkan lagi klien supaya tak keluar duit yang lebih mahal. Okey, mungkin Puan Sal sendiri berapa kos yang tertinggi pernah bantu klien? Okey, Assalamualaikum. Untuk saya sendiri, kalau untuk pembayaran bil untuk takaful di Gleneagles, memang saya nak bagi kredit lah pada Gleneagle Hospital sebab cepat. Dan kos untuk klien saya sebab dia accident masa tu RM60,000. Sebab dia berpindah daripada HSI ke Gleneagles. Memang laju. Memang tip-top. Okay, saya memang recommend klien-klien saya untuk ke Gleneagles lah. Itu saja, dan ada banyak lagi tapi nanti kita share nanti. Okay, terima kasih Puan Sal. Untuk kes saya pun ada juga klien yang warded dekat Gleneagles. Sebelum tu dia warded dekat HSA. Dia kena dengue fever. Okay, dengue fever, and then dia sampai kena masuk HDU. Masa tu sampai buah pinggang dia pun diagnose rosak juga, and doktor yang merawat pun Dr. Alan Sim. Okay, masa tu. So itulah gambar kita tak boleh nak share tadi. So masa tu memang servis Gleneagle sangat cepat. Bila bagi tahu untuk ambil patient dekat HSA sangat pantas. So tak buang masa sebab bukan nak kata hospital kerajaan tak bagus, tapi terlalu ramai orang dalam tu. So dengan servis yang tip-top daripada Gleneagles, Alhamdulillah semuanya mudah, klien pun dapat diselamatkan dengan cepat walaupun kena masuk HDU sebenarnya masa tu. So sebenarnya kan sebagai konsultan takaful ni kita sangat happy tau dapat bantu orang lebih ramai lagi. Dan di musim pandemik ni sebenarnya kita nampak ramai orang yang terjejas pendapatan, dan isu yang paling besar ramai yang dibuang kerja. Jadi dekat sini dengan rendah hati saya suka untuk menyeru semua orang dekat luar sana untuk sama-sama kita jadi konsultan takaful untuk generate income bersama-sama. Dalam masa yang sama kita bantu orang untuk dapatkan perlindungan takaful. Sebab plan-plan di takaful ni memang best, and then lepas tu untuk masuk ke hospital atau claim memang sangat cepat sebab kita ada ISO. Okay, so boleh hubungi kami semua. Kami ada di seluruh Malaysia, IKTiSAS sendiri di seluruh Malaysia. Untuk konsultan takaful ikhlas pun di seluruh Malaysia. Boleh cari saya juga di poster, ada contact number saya. Dan kita akan bantu you all semua insyaAllah, sama ada untuk mengambil plan takaful dengan kami ataupun untuk menjadi konsultan takaful. Okay. Jadi saya rasa tak ada apa lagi, cuma Emily mungkin kita boleh share QR code untuk kita punya audience yang setia sampai hujung rancangan.
Okey, baik. Saya rasa banyak ramai pun sudah tak sabar ya. Thank you ya Puan Hadalina sebab moderating hari ini, sesi hari ini. I rasa it's a very good sharing. I think we should do this more often. Mungkin we can do a next session soon. Yeah, so we can also, this is also ilmu untuk semua orang ya. Jadi okay, sekarang ya, you all standby. Semua dah standby handphone ke? Dah ke? Ready? Alright. Okay ya. Okay, ni QR code kami. Boleh scan tak?
Okay, scan.
So you just scan the QR code and then it will go in. Yeah. Okay, good luck ya. Please register. We will know.
Okay, Ikin dah sukses Tanya.
Dah ke? Okay, this test kan untuk warga lelaki berumur 50 ke atas. Dia senang saja, blood test dengan urine test. Okay, tadi ada gambar-gambar yang ada alat-alat tu, yang tu kita takkan pakai. Okay, yang tu kalau katakan ada anything yang kami rasa ada high chance of anything else, then baru kita akan recommend. Tapi ini test yang biasa je untuk test PPH, test urine semua tu okey ke tidak. So this one is a very good test untuk warga lelaki. Okay, and kalau biasanya you register, I rasa RM 180 begitu. Tapi untuk hari ni kita bagi free for the first 10 yang register. So terbuka untuk siapa-siapa pun boleh, your husband ke, your family ke, ataupun your client ke pun tak apa, no problem. So asalkan you register cepat-cepat, dan bila kita dapat, nanti kita akan inform you all. Okay, so give us probably 2 working days to 3 working days, we'll come back to you. We will contact you if you berjaya dapat test ni. Okay, so meanwhile, semua dah scan ke? So memang banyak ramai lelaki yang mungkin malu-malu, dan your isteri tu tolong push dia husband keluar jumpa doktor. Sebab setahu saya banyak lelaki yang dia malu nak pergi screening, dia malas nak pergi screening. Inilah kerja isteri-isteri yang tolak husband keluar ya. Okay, bawa dia pergi check up sekali. Okay.
Siapa yang berjaya ke tak berjaya ni? Lelaki ni.
Ya betul, kerja ejen juga kena tolak bawa klien sekali. Main paksa ya. Bawa dia pergi hospital, register, dan kita siapa yang berjaya kita akan contact you all lah. Ya. Make sure dia meet kita punya terms and condition. That means kena age 50 ke atas. Okay, warga lelaki. Dengan kalau katakan dia ada masalah kencing ke, yang tu pun okey. Alright.
Ada yang tak berjaya ke? Ke semua sukses?
Semua sukses ke? Okey, sementara tunggu, kami ada soalan daripada Facebook Live. So, tadi ada orang tanya kalau biasanya health screening untuk urologi berapa? Seperti yang saya kata tadi, untuk PSA ni dia blood test dengan urine FEME. Yang ini biasanya harganya RM100, tapi ini tak termasuk doktor. So kalau masuk doktor urologis around 180 macam tu lah ya. So second question, dia kata ni daripada Facebook Live juga. Peserta ni Amir. Okay, Amir tanya, doktor, some people say that if make biopsy, the cancer or sickness will become worse. Is it correct, doctor?
Yeah. We hear this being mentioned very commonly, especially in the elderly. They have the impression that once you cancernya biasanya kalau tak, just leave it alone, don't want to disturb, then everything is okay. Once you go and biopsy, dia akan spread, dia akan macam jadi lebih advanced. This is the wrong thinking. The spreading from biopsy is not true. It doesn't spread from biopsy. If you talk about us going through the skin and then it spread to the skin, is never unheard of. So it is just a wrong thinking. So we have to change the mindset. We have to advise them. The earlier you do the biopsy, if you detect the prostate cancer earlier, prostate cancer is actually very, very treatable, very manageable. Most men don't die of prostate cancer if you detect them early enough. So you die with prostate cancer means you die of old age, you die of heart attack, you die of stroke with the prostate cancer still being managed. So if you detect early enough, it's not a problem. But if you detect in the late stage, then you can die from prostate cancer. So the key is early diagnosis.
Okay, thank you, Doctor. Okay, so I think that's about it. Okay, I rasa semua dah nak register. I rasa sudah register. Okay, so if you have any other question, feel free to contact Puan Herdelina ataupun you can drop a message dekat FB Live. Kalau katakan ada anything, I think Puan akan forward to me. Okay, untuk agent-agent, keep in touch. Okay, so if you have any questions, feel free to WhatsApp saya. Yang tak ada nombor saya, let Puan Herdelina know. Okay, then kita akan share kontak kita. Right? Okay, I think back to you, ya Puan. Anything you want to share sebelum kita end?
Thank you Dr. Ellen and Emily for very good sharing. And soalan pun sangat-sangat banyak. I think semua orang puas hati hari ini. Okay, sebab dapat information daripada doktor, especially berkenaan dengan urologi ya. Dulu pun kita tak berapa nak tahu sangat urologi ni macam mana. Okay, ingat asalkan batu saja memang kena jumpa urologi. Rupanya ada certain area sahaja yang di cover. Okay. So other than that, mungkin kita boleh bekerjasama lagi in the future untuk dapat ilmu lain lagi. So terima kasih semua yang support hari ini sampai habis. Itu sajalah dari kami. Thank you so much everyone. Okay, Assalamualaikum warahmatullahi wabarakatuh.
Thank you.
Bye.
Semua.